Good afternoon, everyone. And I shouldn't have bothered wearing a tie. It's inconsistent with the wonderful atmosphere that you're going to be enjoying here over the next few days. But I am very pleased to be here on behalf of Premier Redford, my colleague, the Honourable Steve Kahn, the Minister of Enterprise and Advanced Education, and all of us in government to first of all, to welcome you, particularly those of you who are from outside Alberta and outside Canada. I know there are a number of you here today. And we're very, very pleased to have you here at what I think has become one of the most distinguished conferences, annual conferences in Alberta, put together by Alberta Innovates Health Solutions. So welcome to our province. I want to take a moment. I was asked to reflect a little bit on your theme of value over the next couple of days, and I thought I'd take a moment to perhaps give you my perspective on the topic, both my perspective as someone that's worked in health policy for a long time and now a new perspective as a Minister of Health in Canada. And I'm excited that you've chosen this topic. You know, I can tell you, I guess more commonly when you talk to politicians, you probably hear us talk not about value, but you hear us talk a lot about cost. And as Canadian Medicare continues to advance, we obviously spend more on healthcare than we ever have before. I can tell you in Alberta, our budget is $17 billion, or just about 41% of total provincial spending. And in other parts of the country, Ontario and Quebec, they are rapidly approaching the 50% mark. And so for people who are concerned with economics and people who are concerned with other important sectors of public policy in which we need to invest, those statistics can be cause for concern. And I've certainly always had the belief, and I hope we never reach this day, that once healthcare spending reaches 50%, you know, it actually then becomes an opportunity cost for other areas like education and infrastructure and the environment. So I think we have a responsibility as governments and as health ministers to try to make sure that that day never comes. And I think one of the ways we can do that is to work on a regular basis, but on a strategic basis with the people who are doing research about healthcare, both here and around the world. So, to the question of value, from my perspective, you know, we can choose to step back from cost, and we can start to think about, I think, three areas that are at least concern to me. The first is overall health system performance, and we all read the benchmarking reports that come out from time to time. And if you know Canada, you will know that we are, I think, the third highest per capita spender in the OECD, for example. But our performance in areas like health status, important areas like health status, tends to be middle of the pack. So we have a lot of work to do in terms of thinking about the performance of our health system. My observation and our government's, in fact, focus at this point in time is to focus a lot on the question of health status. And we think that as much as we need to continue to invest in technology, and we need to attract the best and the brightest researchers from around the world to come to Alberta, that if we really want to tackle the question of value, to a certain extent, it behooves us to go back to basics. And for that, for our government at the moment, that is a renewed focus on primary health care. We made a commitment in the election, and we will live up to that commitment to provide each and every Albertan, by virtue of being a citizen of this province, with the opportunity to be attached to a primary care team in or near their home community. And this obviously is very important in terms of physician access, and we need more family physicians, like most jurisdictions. But it will also allow us to take better advantage of the full scope of practice and expertise of other professions who have a lot to offer. And I'm thinking of practitioners in nursing, pharmacy, rehabilitation, you name it. There are many, many practitioners out there that can do us a lot, for example, to assist us with meeting the demands of a rising prevalence of chronic disease. And for whatever reason, we have not paid sufficient focus and attention to how we can make better use of those professions. So this focus on the attachment or the relationship between the citizen and a community-based team of care providers, we believe will give us the platform to get at this question of value. Measuring value in terms of improving the health status of our population. And I'm sure many of you know this, and it's something that keeps me awake. This is the first generation of children in Canada to have a lower life expectancy than the generation that precedes it. In a country with our resources and in a province with our resources and our history of providing good quality health care, I think that's a cause for concern and a call to action on the part of all of us. So we'll obviously be looking at health status. You have done tremendous work in the second area I was going to talk about, and that's healthcare outcomes. In other words, how well someone fares after a particular interaction with the healthcare system. And Alberta is home to some tremendous advances in areas such as cardiology and diabetes, many Canadian firsts, many global firsts in this province. And I think we need to continue to focus on improving those outcomes, and to the extent that's possible, quite frankly, stop doing things in the hospital that we can do in the community. And there are many of those opportunities, I think, in front of us today. And then the third area is the overall performance of our healthcare system. And of course, that's measured in things such as cost efficiency in our system. And we are getting better at costing the services that we deliver. But I think we've equally got to be concerned about how our system fares overall, how well we're using data. To borrow something I learned from Dr. Noseworthy, who you'll hear later this afternoon, how well we're doing at identifying protocols and technologies that have become obsolete or obsolescent, and stopping doing those things because we know we have evidence to support a better way of doing them. And so those sorts of decisions, and just in closing, are going to be driven by research, and in particular by the work that you are doing. And I know that will have an effect in Alberta, but I know it will have an effect nationally and globally as well. So in closing, I'd like to first of all make sure you understand how much we value the work that AIHS is doing and our partnership with you, the work that you are doing individually in research. We are a province, despite some of the structural changes we've made in the last couple of years, we are still very committed, and we have staked our reputation on a belief in the importance of the integration of research, education, and excellence in clinical delivery. And we will continue to do that, despite how we may make changes to how we do things. That core belief that integration is the pathway to excellence will persist. I will be very interested in following your work and looking to see how traditional silos are broken down, and I know many of you are thinking about that. In looking at problems in the healthcare system that are not clinical necessarily, but that require management solutions. That's a very important area for people such as myself to be paying attention to. How can we organize and manage resources better so that we make better resource allocation decisions that we know, because they are supported by evidence, will result in the outcome, the health care outcome or the health status outcome that we want to achieve for our population. So just to finish up, thank you again for the privilege of being here. Your new ideas and your new approaches, I think, are going to be important for many reasons, not the least of which is that you are focused on the future. If I could say one thing about healthcare in this country, in my time in working on the policy side of things, we spend a lot of time studying the past. We have a lot of evidence to support what we know doesn't work. We really need to come together and work to study the future and what some of those opportunities might be. And I know you will all be leaders in that regard. So thank you very much for the kind invitation to come. I hope you enjoy the conference, and most importantly, thank you for your work and your contribution to improving healthcare.